Record on this computer. All right, we are recording. We're back in business. Here we are with Dr. Seth Kadish, part 2. All right, so now we'll get into the nitty gritty, Seth. So how many people do you usually have in a group? What's the minimum that you think it's a good, vibrant group, and what's the maximum?
Okay, so for trauma and process groups, we ideally run between 5, 6, and maximum 8. You don't want 2 people in a group where there's all that feeling coming out. For a psychoeducational group, we usually max out at about 15, 16 in a 50-minute group.
Okay, and is there yeah, it's almost like a class.
Yes.
Is there a minimum?
You know, interestingly enough, I've done groups with 2 or 3 people a number of times. And if it's only one person, I just turn it into an individual session, you know, as simple as that. But yeah, many times I've worked with just a few people. It's a lot better with more because we have more energy and there's more dynamism in the room. But yeah, we could work with a couple. I personally love working with a big group, and the most I've ever had at PCH was 27, which was
that's a lot of lions.
Which was for me, it's a exactly, but it was a lot of fun. I loved it, except when it came time to do the notes afterward. 27 took me more longer than the group. So yeah.
And is that a casualty of running groups in a facility that you have to take a note on every participant in the group?
That's right. That's a whole other topic. That could be part of our certification program.
Yeah.
We'll talk about how to write effective notes. But really, a good facility should insist upon writing an individual note for every client in the room, even if there are 27. It should not be copy and paste, should not be cookie cutter. Shouldn't be. Yeah. So poorly run or poorly managed facilities, they'll do that, but I frown on that.
Let's say you had 8 people in a group, and the group runs an hour and a half, most of them?
Many of them run 50 minutes.
Oh, 50 minutes, okay.
Right, so we have a number that run 90 minutes with a short break and a number that run 50.
Okay, and so let's say in a meeting, either 50 or 90 minutes, and you have 8 clients in the group, how long would it take you to write the notes? I imagine they're not as extensive as the notes that you write for an individual therapy session.
No, they're not. They're formatted as well. So we want to know about behavior in the room, mood and affect. We want to know what the client basically contributed to the discussion, or did they not? And then we want to write our intervention, assuming we did something. So that might
Your intervention for each person?
Yes, that's right. So let's say, as you know, I specialize in patterns work.
Yeah.
And so let's say that I had a very specific exercise, something simple like writing your strengths and weaknesses. And so I'd have to talk about how did the client present in the room, right? Were they an active member? Were they engaged? Were they thoughtful? Whatever. The mood, are they in a stable mood? Are they in some kind of mildly depressed mood? What did they contribute? Well, Johnny wrote about his pattern of people pleasing and caretaking, yada, yada, yada.
Okay.
And the tricky part would be the intervention, because maybe where I coached him, here's an effective way of diminishing a people pleasing pattern. And I would have a different intervention for Rhonda over here, who maybe I queried her more about her early family dynamics.
And what happens if if the intervention is at the level of the group, where you're just having people interact and comparing notes on a particular pattern? Let's say you have multiple people who do people pleasing and they all were sharing with each other.
Right. So let's say that was the case, then I could, in a sense, copy and paste that there's something that they all did, but I still would need to find something that I gave to them that was unique, which could be a little challenging, but to me, a good group facilitator will find. Well, let me segue if I can. Okay. We talked about rules.
Yeah.
So one of the basic what's what I'm looking for, technique or task might be a better word, that a group facilitator should do. And again, I stress that even people with experience, they miss this step. And I know, because as director of group therapy, I hear about it from the clients. And that's a very simple step of introducing yourself what the group is, what the rules and format is, and making sure that that new person knows everybody in the room.
Okay.
So there are some really basic things that we want to make sure to cover. I know we were going to talk a little bit about techniques and
Yeah. So let's say we imagine we have an imaginary group. How would you start? How would you set these rules? That you would set those rules in the first meeting, right?
right, the first minutes.
Okay. So
Yeah,
what
it's
would you
kind of
say?
like a
What
classroom.
would,
I
what are
am
the
Professor.
rules?
What would I do? I would
Yeah.
say patterns. I'm Dr. Kadish. Welcome to Patterns Group. I have literally a 30-second explanation for the group. I'm not doing anything longer than that just to get them involved. Let's go around the room. Let's say your name, assuming that this was a brand new group and they didn't know each other, which again is unlikely in a treatment center.
Yeah.
Uh, and then let's see, right, introduce the format. Yeah, that would be the basic steps that I would take.
What about
And then,
in a process group? Are there different rules there because there's probably a lot of
yeah,
interaction?
yeah, actually, I'll tell you, I do my process group a little bit differently, though everybody has their own style. The way I do that is I do a very brief check-in at the beginning of group. Let's say 5, 6, 7 clients in the group. Brief check-in could look like literally a minute or two, go around the room. If it's a new person, what I do is obviously, I've introduced them to the group, what we do, myself, and had everybody say their name. And then I would hold them to last, and then I would get into their biography. So I'd spend probably between 5 and 15 minutes to find out who they are. The group asks them questions. They in turn would get to ask other people questions, or what I often do is have all of us, including myself, give a very brief, like maybe 1-minute bio so that the new person knows who we are. And yeah, it's very important to make people feel comfortable in the group as soon as possible. I think
Yeah.
that's highly important. I think it gets overlooked, really
Yeah.
do. Um, I mentioned before, can I talk for a minute about rules?
Yeah, definitely.
Because it kind of goes hand in hand. So what I've noticed is better facilitators or ones who are more experienced, they make sure not just to introduce the rules, but to enforce them. I think the big drawback or the big issue I have with facilitators who either are not as adept at this kind of work or don't like it or are lacking experience is as simple as that they don't maintain, they don't establish and maintain rules because they're scared of the client or they want to please the client and they don't want to, going back to what we spoke about earlier, command the room.
Yeah.
So some really basic things to watch out for in our groups is, no eating during group, no cell phone, no side talk, using odd language, certainly no cursing, no violence in the room, which can come up, or really threat of violence. Uh, uh, if a client is sleeping, what do you do? That comes up in all treatment centers, particularly dual diagnosis, where the client may be in withdrawal from drugs or alcohol,
Hmm.
on medication. So what's the rule about that? Is we're not going to penalize you. We understand why you're sleepy, but you need to leave the room and find a place to lie down.
Okay.
So I never skirt around that. And I always think it's important to address rules and structure right away because you're not going to have a good group, particularly if you're dealing with difficult clients until you really have that as a foundation. It's kind of like the individual uh, framework that you create, right? There's a framework in the room that
Frame,
you
yeah, the frame of therapy.
very
Yeah.
right, exactly.
So the group has a frame too. Yeah, and I don't think any kind of uh, effective growth can occur without some kind of frame so that people feel safe and contained, within the room. What
Yeah,
about if somebody gets triggered and wants to leave the room? What's your rule, your policy on that?
that's never happened in my experience.
That yeah, right. Like it's never happened except on the third Friday
Right, of
of the
2017 at noon, it never happened.
yeah.
Right, so that happens constantly. Um, so ideally, and this has happened, it's possible, we'd want to work with that. So rather than the person bolting out of the room, assuming that they're not being violent, and I want to say something about that in a moment, but assuming that they're
I love
sit there, fill them out, and have them put on the question. I'm really angry, Dr. Kadish. You hurt my feelings just now. You said something that triggered me, or something like that. What's coming up for me right now is I'm crawling out of my skin with anxiety because Marcy over here made a comment that I didn't like. So we want to work it through when we can. I do always, though, caution facilitators if a client, let's say they're standing, they're at the point when they want to bolt. I may stand with them, but I never interfere or get in their way, which is another rookie mistake where we want to either soothe them, or if they're a particularly or possibly explosive client where we want to interfere with that, let them go. In fact, encourage them to go.
Yeah.
Don't keep clients in the room. But if they can stay and work it out, again, all to the good so that they learn how to process rather than react.
And do sometimes the client who is triggered and is having a hard time staying within the group, do they make it back, or do they generally leave for the duration of the group?
More often than
Allowed
not,
to return.
but sometimes they will come back on a break or later and, kind of walking quietly and say, can I come back? Sure, let's come back and talk about what's gone on. We also, as group facilitators, have to recognize and deal with not the wreckage, but the aftermath of their explosion or their meltdown because it's affected other people in the room. Let's say Johnny is stood up angry and enraged, and he's a big guy and all that. Well, I have, little Joanne over here who is mortified and literally curled in a fetal position. So we have to process that. We also tell people that this is all grist for the mill because they may say you need to throw Johnny out of the program or you need to do something extreme. It's possible, and we have done that on occasion, but sometimes it really is a teaching lesson for all concerned. Facilitator who is experienced will know how to make use of that meltdown.
Right.
Yeah.
Yeah. So you set the rules, and then what about these? Give us a flavor of some of these different categories of clients and how they might present, what kinds of issues you might have to deal with, and how might that look in the room?
Okay, so a couple off the top of my head. The clown, the Joker, that's the person who comes in and is not taking it seriously and is side talking and is a wise ass when you ask them a question. How do you deal with that? So part of the way you deal with all this is through your own personality. So let me just veer off for a moment and come back to that.
Okay.
We'll come back to Joker. So I actually have identified 4 essential, I'll call them components of what I think will create a compelling group. And I have a little note here so I didn't forget what they were. It's in that workbook I mentioned.
Okay.
Real quick, mystery, passion, creativity, and the 4th one is where I was going, which is authenticity. And so I talk a lot with group therapists, or as they get to know them, I find out really who they are. We all have different personalities, temperaments, and skill sets, and I'm always encouraging people, bring that into the room. Mm-hmm. So real quick, when I started out, like a lot of people in master's and then doctoral level program, we got to watch back in the day, you probably did too, a lot of Carl Rogers, Fritz Perls, all those guys.
Yeah.
I remember, not consciously, but kind of imitating Carl Rogers, who is, this nice Midwestern person.
I always wanted Carl Rogers to be my grandfather. Exactly. Would he be the best grandfather in the world?
Or uncle,
Yeah, so warm and.
Exactly.
Yeah.
So what happened is, so I found out as I got a little bit experience and again starting to work with the kids that I wasn't so much godly like him. I was more Godfather, So that's my background is Brooklyn, New York, and more no nonsense. And so instead of shirking away from that, I actually started using that. So not necessarily creating a false persona, but really being who I am and who I feel comfortable being in the room. Some people like it, a lot do, some don't. So now going back to the Joker, how I would deal with it might not be how I won't name colleagues by name. I'll make up a name. I'll say my colleague Susie.
Yeah.
That we know in common. who has a great sense of humor, and she would probably make more of a joke and deflect the person. Interesting enough, meeting a joke with a joke, but somehow pointing out to them, you're being a little jokey right now, whereas I might be a little bit more right to the point and say, Sam, you keep making the jokes. Let's stop it right now, and then maybe talk to them after the group and address it as a problem and say, we can't keep having this. But I would also, to be fair to them, with all these difficult clients, I always will delve below the surface and find out what's provoking the jokiness. So establishing.
I would think I was surprised when you manage the behavior in the interests of maintaining the group and the cohesion of the group. But I was thinking, especially from my more dynamic, background, what is that defending? What's underneath it?
Right.
And so you do, after you contain things, you might go and explore a little bit and do an inquiry.
That's right. And the thing is, it's tricky where group facilitators also, and again, have been guilty of all these mistakes and still am on occasion, but a huge mistake that they make is they'll stop Sam the Joker and say, let's talk about that. What's going on? Where I'm from, blah, 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 blah. And the problem is you've now pissed off the other 10 clients in the room who were there to learn DBT skills. You've turned it into either an individual session or more of a process group. So that's why I would manage it and just put the kibosh on it and then later talk to the client, which, by the way, leads me to another point I think is a very, very effective tactic in group therapy that I don't see too many people doing, and I'm often teaching it. And again, Rich, all these are simple. None of them are complicated. Just a question of doing them. Is let's go back to Sam the Joker. Okay, so he's been side talking and a little bit disruptive and trying to make a bad joke and deflecting and all that stuff. And I've said, stop it already. Hold on. And then on the break or after the group, I'll say, can I talk to you a minute? Sure. I'll talk to him then. If he's not around, what I'll do is when I see him out and about, or I'll find him out and about, I'll talk to him then. In other words, I do a percentage of my group work, not in the group room. I do it in the hallway. I run into a guy in the bathroom, wherever it might be, and I'll banter or talk or check in. There's so many ways of forming alliances in the group room, which is one of the things that I talk about and like to teach, is I always want to have at least one person in that room that's some sort of an ally. Now that may seem almost like a little bit street, which in a way it is, but I know that, let's say I've got you to cover my back, so if I have a disruptive group, I have Rich, hey guys, knock it off, Kadish wants to teach or wants to talk. And where I really learned that, by the way, was when I spent my first horrible year working with the probation girls. That was one of the things that I learned to do. I just went back to my Brooklyn roots and said, this is what I would have done back in the neighborhood. I'm going to do it here, and it's effective. It's kind of like the old joke about where the new substitute teacher or the new teacher comes in the classroom and says, does anybody have a problem with me? And, Big John, 6'6", all tattooed, whatever, stands up and says, yeah, I have a problem with you. And you say, really? Come up here. And you put your arm around his shoulder and say, anybody have a problem with me and John? I'm screwing up the joke, but you get the point.
Yeah, exactly.
So out on the room and checking in with clients, and they really appreciate the extra time and effort, which ties back to the topic of passion, because they know I care about it.
I want to just bore in a little bit more deeply on the intervention with the clown. So you kind of, like jumping to a little bit of a lily pad, like you jump there, you do a quick intervention, but you don't do a sustained inquiry and make it into an individual session. I would think that someone who has a lot of training and experience in individual therapy, this would be one of the hardest transitions to make. I was imagining, for me, I immediately, as an individual therapist, I do what's called a sustained empathic inquiry. And I'm going to go further and further into it, for some hopefully good resolution. But in the description you have, you note it, you do an intervention, and then you move on. Um, uh, do you bring other people into it, or do you move on to another topic? How do you keep moving?
Right. So, and part of the keep moving is I have to be very careful with Sam not to shame him. So I don't want to come off too harsh or too punitive, and I have to have a light enough touch where I'm going to stop him and move on and talk to him after without destroying him. He may have very poor ego strength.
Yeah.
So yes, and that's a good analogy. The lily pad jumping and jumping. Uh, Now, if it is a process group, though, then maybe I can do more of the sustained inquiry. But even then, I want to watch it because another complaint that people get, that experienced therapists get, is, hey, we had an hour and a half group, and you spent an hour and 10 minutes with Diana. So even though there was a lot of meat there, and they could benefit from hearing it, the other group members could benefit, they'll still feel resentful. And in
Right.
that sense, I know that you and I are touching on so many things, but another interesting dynamic that comes up in group work is for a lot of clients, sibling rivalry, not just in process groups where people say, you showed a lot of favoritism to that one or that one.
Yeah.
So part of it is time management, which is another going back to the rules and the structure. And I'm literally raising my hand because I have a pet peeve. And my pet peeve is not so much clients who show up late, because they do, and there's rules about that, facilitators who don't start on time. It is such a basic mistake to make. They think nothing of it. It's only 2 minutes late, and clients will come over to program directors and clinical directors
Really?
and complain. Yeah, oh yeah, many times, because they feel it's disrespectful or they're not modeling what they're asking us to do.
Yeah. Yeah.
So, but a bigger peeve, and this is a very fascinating one to me, and this will come up also for those of you who are newer and do groups. It's a
I should
common,
tell you though, for this class,
yeah,
that in the syllabus, I got very firm and clear about punctuality, that the class starts at a particular time. And the reason I did that was to inculcate them with this idea that if you're a professional therapist and you have a session that's beginning at 9 o'clock, you don't wander in a few minutes, afterwards. And
right,
at the end of your practice, so you
right,
have to be there right on time and begin right on time. That's
right.
part of the frame.
Exactly, exactly. But there are group facilitators who they tend to be a little sloppy with that. But here is one that's even worse to me, which may surprise you. All right, let's say that the group is designed to go from 2 to 2:50, and the next group, whatever it might be in that same room, is going to start at 3 o'clock. So, Rich, over the years, I've had a number of people who they went till 3 o'clock, and then they came to me, not just defending that, excited. We had an amazing group. And for the first time ever, Maria started crying right at the end. And now,
Yeah.
as an individual therapist,
Yeah.
you cut it, that's the frame.
Right.
And it's the same thing with the group, because what happens is that facilitator going that extra 10 minutes means either that the clients in his group are going to be late to their next group, which
Yeah.
will mess things up, or um, it's a problem because they will be on time to the next group and very resentful that they didn't get a break.
Yeah.
So I'm a bug about if your group is 2 to 2:50 to the minute, make it that.
Right. And I think here there is a similarity, between the group work and the individual work in the pacing of the session, that you have a little bit of a sense like, there's an introduction, and then you try to deepen the material and get into things that are meaningful and substantive, but you have a sense of how the time is going, and then you begin to sort of pull out of it's almost like going for a deep sea dive. You begin to come up, and to the surface, and then you end it. I've often said to people, like, I don't need a clock to know. If you say start now, I bet you I can like say when 50 minutes are up without
Right.
a clock,
I
because
bet
I've
you
done it
could.
so many times.
Right.
Probably you
Right.
in a group as well.
Yeah, or right, and you mentioned deep sea diving, and I mentioned lion taming, and another analogy that is very applicable is orchestra leader. that you're calling on, right? The different instruments, and you have a sense of, again, the entirety of the composition, beginning, middle, and end.
Right.
So I would absolutely agree with that.
Now, in terms of your client types, you mentioned the clown and some
Yeah.
of the difficulties that might have, but what about the one that strikes fear into prospective group therapist, which is, you know, a really difficult, maybe even aggressive client?
Right. So that's the angry or the oppositional client. But
Yeah,
let me distinguish that client between the psychopathic client, who the good news is they are far and few between,
that
because
they're
you're
actively
angry.
trying to disrupt the group.
Right.
Mm.
Right. And you and I have actually had conversations about the topic of psychopathy,
Yeah,
widely misunderstood by a lot of people. But yeah, the angry oppositional client is somebody we come across fairly often. And so, kind of like with the Joker, the important thing there is to establish that they have to curtail that energy. We have to make them be very aware of what they're doing and stop it, if necessary, even a behavioral contract, and if necessary, remove them from the group. That said, as with,
what
yeah.
things might they do to derail the group?
So the worst thing that they can do is raise their hand and interrupt you. And I'm just shooting from the hip here and say, you know, I don't even know what this group is about. It's a bunch of bullshit to me.
Uh,
Okay, John, well, let's talk about that on a break. No, no, no. And then looks to the other clients for support. Don't you guys agree with me? And basically causes, you know, a viva la
a mutiny.
revolucion,
Yeah, yeah,
you
yeah,
know? Right.
yeah.
And so tries to rail everybody against you. That's a worst case, horrible scenario. I've been through it a couple of times, and all I could try to do is remain a calm presence and keep addressing that one client. And just again, tell them we'll talk about it in the break. And if they're really that insistent, I've rarely had to do that in 20 plus years, but I would conceivably actually stop the group and get some kind of support staff to escort the client out, or just directly ask the client to leave if they're that unhappy,
Yeah.
because there's no sense of them downloading anger or even addressing your own failings. They just want to cause a riot, which they've done at that point.
Right.
I mentioned the psychopathic client because the difference is the angry person, as we know, there's so much underneath. They're usually in terrible pain. There's a whole agenda there, and we could work with that.
Yeah.
One of my maxims is, and I'll just throw this into the mix here, is, and I actually really utilize this in my prison work. I would go soft with hard clients and go hard with soft clients.
Mm-hmm.
So the angry opposition one is a hard client. I'm going to do my best to not have a control battle and go soft, but that doesn't mean letting them hijack the group. It
Right.
simply means my tones and my whole approach would be a little bit more calmer and softer with them. The psychopath simply wants to mess everything up. It's as simple as that. And to me, because of my background and work, I'm fairly able to recognize when they walk through the door, so I can talk to the administration about that client. Interesting enough, sometimes they're very, very compliant. So they don't always go that way of damaging the group, but they're cold-blooded as compared to the hot-blooded, angry oppositional client.
Right. Right. Now,
There, because that's a whole other
yeah, all of
training or
the
teaching we can get into.
all of the clients in the group within a treatment center like PCH are concurrently involved in intensive individual therapy. How much do you investigate the themes and the issues that are going on in the individual therapy, or do you want the material to come to you organically through the group?
Well, I prefer it to come through the group. And oftentimes what they'll do is they'll either touch on or summarize, let's say, the work they're doing with you, or what may happen is they may just reference it in passing. They'll say, you know, I'm working on my codependency pattern, and you know, Rich and I were just talking about that this morning, and he suggested blah, blah, blah. So a lot of it does bleed through. We, of course, are in a unique position where we can confer with one another as well as look at notes.
Yeah.
But for argument's sake, I have my own predilection that when a new client comes in, I actually, and any treatment center that I'm affiliated with, I actually don't like knowing much about them.
Yeah.
So for argument's sake, when I do my milestones work, what I like to do, just for the first meeting, after that, I'll take reams of information, is I'll ask the tech staff, the support staff, and they know me well enough over the years that they know that I don't want the whole bio. I'll ask them simply, good client, not good client, or something to that effect. And what I mean by that is, are they compliant or are they going to be oppositional? Do they
Right.
want to be here or not?
Yeah.
Whoever they are, I find out. And so I have kind of an unfiltered view of the new person walking into the room. I prefer to do it that way. And then, like I said, afterwards, I'll confer with all sorts of people.
And
Get collateral.
do you initiate the conference with the individual therapist sometimes? Like if some important information is coming out in the group and you're not certain that the maybe new information that may not have come out in individual therapy, will you initiate sometimes
Yeah,
conversation?
in fact, what I'll also do is ask group facilitators to share stuff that came up in the room that they think is of importance. Like, a gravely important fact might be the client talking about suicidal ideation.
Sure.
Chances are 99% of the time you already know about it.
Right.
You've been
Right.
hearing about it, but we want to make sure. But what we may notice is, for argument's sake, something like, let's say, have a client the other day who seemed to me a little bit on the hypomanic side. So I'll pass that information on saying, is everything okay? And then I might find out from a program director or the individual therapist they're starting a new medication, or they got a bad phone call, or, gee, thanks for telling me, because no, I had no idea that the mood was starting to elevate.
Right.
But that goes to the nature of working within treatment centers and teams where we do typically share information,
Yeah. Yeah.
right?
Have you ever talked to individual therapists that do group work in private practice? Have you ever encountered them? Because I know a couple of them that do that. Not very many, but
Right.
it sounds like a bear in terms of getting clients in the right group and maintaining clients. But it'll be interesting to see if the presentations are different, um, whether your categories of clients would be different. I imagine they would. You probably wouldn't
Yeah.
have people who are going to private practice and plunking down, extra money that way, who are acting that way. I'm not sure, but probably not.
Well, within the treatment center, just kind of speaking to this notion of clients being different in the individual session versus the group room, right? Because in a sense, you're at a little bit of a disadvantage, as are we in another way. But your disadvantage is, of course, you don't get to see your client interact with 8 other people. And what's the pattern, right? Are they
Yeah.
isolative, or do they withdraw, or do they tend to be jokey and hide their feelings? Which for you, they're pouring their hearts out, and for me,
Right, right.
right. And then our disadvantage, of course, is depending on the nature of the group, oftentimes we do not get to do the depth of the work that you're doing. And
Yeah.
so not just the information, but to really have that person bear their soul or share the emotion, which is really profound in the individual work, we can often miss out on that. So
So
I think it's great.
do you think it'd be valuable for individual therapists as a matter of course to check on some recent notes on their clients and how they're operating within groups to get a
Yes,
wider picture?
yeah, and I think that people who are a little bit more, again, experienced and responsive will do that. They'll even say, hey, I read your note the other day, and that was very interesting. Tell me a little bit more. And again, good group facilitator will probably want to spend some time with the individual therapist or the program director and get more info.
Yeah, yeah. Now,
Yeah, I think
did we cover all the four? We covered a little bit about passion. We covered authenticity. And you know, I just
right.
want to just throw in one thing that we did talk about, because I also feel that authenticity is critical quality of a good therapist. And in fact, Rogers, who we mentioned before, talked about this sense of genuineness, a sense of congruence, that what's inside the person is also what you feel and what you see. So he really looked at these therapeutic
Right.
emotional attributes, and I think authenticity is very close to some of the ones that he felt were important. And I agree with that very much. You have to be somebody, and that it's not just techniques, but it's the person who implements, the techniques.
Yeah, right.
Often say you have to be somebody to help somebody.
We, I was flashing on, if I can just jump in here, because
Yeah,
I'm flashing on two of the facilitators that we work with who are among our most valued and elite facilitators.
yeah,
They've been at Stage many years. The clients love them. And it's very interesting. And I'm not saying this to pat myself on the back. It's more hand in hand with what we're talking about now, which is when both of them started, they didn't do that well at first. The clients didn't seem to like them and they weren't enjoying themselves. And I remember saying to them, one of them who's a very, very funny, witty, down to earth person, I said, well, why aren't you being that? And the person basically looked at me and said, in so many words, well, can I? Am I allowed to do that?
yeah,
Right, because a lot of times you work within organizations and structures where they don't encourage that kind of authenticity. And
yeah.
then the other
I think
person who,
I think in any therapist starting out, that they really stay tight to their theoretical models and their techniques, and they implement them. And I think as you become more comfortable in your own skin, and that you
right,
realize it is a relationship between two people, and an exchange between two people, that within the bounds of professionalism, that you become more real in the room as you
hmm,
get more comfortable and experienced, and find a way to
exactly.
implement these techniques in a way that's natural, and, as you mentioned, authentic. We just
It,
we
it,
just have I'm sorry, go ahead.
okay. I was going to say in the workbook, that's one of the exercises that I ask people to do, which is essentially, who are you? And it's okay. You're Woody Allen, you're Mother Teresa, you're John Gotti. I mean, whoever you
Yeah,
are, we're going to use it and work with it.
right.
But yeah, you have to be true to yourself, because clients, man, they have built-in bullshit detectors, and they will know right away, are
Yeah,
you the real deal or not? Kind of like the substitute teacher who's a little bit anxious Nancy, and they write over her or him.
exactly.
So it's highly important. What were you going to say a moment ago?
Well, we just have a couple of minutes, and
Oh,
I just wanted to make sure that we covered those four essential elements in terms of the group therapist. You said that they had to be passionate, they had to be authentic. You mentioned mystery, and there was
right.
one other one.
Creativity. And creativity, I'll leave mystery for last, is more on the obvious side. Creative means, and I can give, if we had time, a number of examples of groups that I've created and other people have that are extremely interesting, fascinating, outside the box kind of groups. I think it's fun for us as well as the clients, and lots of deep learning. Mystery uh, is something that I kind of stumbled upon years into doing the work. And by that, what I mean is, I'll give you an example. Client says to me after group number one, what are we doing in group number two? And I make a joke about it, or don't tell them, or something, uh, some reaction to what they're asking me. But the bottom line is, I'm not telling them. I want them to walk into the room curious and they don't know. It could be something as basic as changing my seating position or the clothing I'm wearing. In other words, creating almost a bit of anxiety in the room is a
Yes,
good thing.
yes,
Right, because people sometimes want to soothe them, like, no, because now you're on toes, you're engaged. Uh, my workbook is called Facilitating Compelling Groups. And so, how do you compel people? How do
yeah,
you compel somebody to turn the pages of a novel unless there's a mystery that they want to, unravel? So I
right.
think that's a very, very important element of a really exciting group. They're not predictable or less
Yeah.
predictable.
Yeah, that sounds great. Um, let's. I think we need to stop right now, because I'm getting
Yeah.
indications. I think we might have even gone over. I'm not even sure we're recording
Oh,
right now. But anyway, if you can send me the digital form, your workbook, I'll definitely get it to the students. And you know, I think we could have done a whole another one. But
yeah.
let's just less is more. And I think it
Okay.
really did give them a good flavor of what it means to be a group therapist, and how groups operate, which is exactly what we wanted to get across. So thank you.
Good.
Thank you a
Yeah.
lot. I'm sure you and I are going to continue this conversation at various
Well,
times.
Exactly. Okay, Rich. Well, thank you very much, and hope everybody enjoys this and got something out of it.
All right. Thanks a lot, Seth.
You bet. Bye.